All right, I'm going to demo a couple things around feeding and burping and spitting up with this little baby of mine. When you're feeding your baby, you always want to make sure that they're in a good position with their head supported. So by good position, I mean everything is aligned. Your head, shoulders, chest, everything is in a straight line. So you don't want to be eating like this. This would be a hard position for anyone to eat in, right? So you want to make sure that you're straight. So keeping the baby straight like this and not having their head turned to the side. And then you can support their head like this, or the other way is with your hand. So if you make your hand a V shape, you can place it behind their head like so. This gives you really nice head and neck control and support for your baby. And your thumb and forefinger are kind of by their ears. So you can feed them like this. And whenever you're feeding your baby with a bottle, you want to make sure that you never prop the bottle up with anything. You want to pay attention and always be watching your baby while they're eating, just in case they do spit up or struggle, or you're going at too fast a pace for them. You can react very quickly. So now let's say your baby is all finished, they're nice and relaxed, and they're done with their feeding, so you're ready to burp them. So there's a couple ways to burp a baby. When they get a little bit bigger, you're probably mostly going to do the over the shoulder technique, and as long as their back is straight, you can burp them in this position. But the first couple days to first few weeks, sometimes that is a tough position just because they don't have a lot of neck control. So another position I want to show you is sitting upright. So with your baby sitting in your lap like this, you're going to actually lean them forward onto your other hand. And my hand, again, is in a V shape, and I'm kind of supporting their jaw like so. And my thumb and forefinger are also near their ears, and you're supporting them like this. So it's not around their neck, it's actually supporting the bones right here. And that's a really easy position for them to kind of have gravity, be leaning forward a little bit, and keep their back nice and straight. And then I highly recommend using a burp cloth because sometimes things come out. So we're gonna do that same thing, but with a nice washcloth like this. And then you just wanna pat their back. You wanna pat gently but audibly. So you wanna hear a little drum beat. Sometimes new parents are really gentle and they go, and I'm like, I don't think anything's gonna happen. You gotta do a little bit firmer than that, but of course we're not going super hard, but just enough that we can hear a nice little drum beat. Okay, and when you've done that for about a minute, and the first couple days, they may not burp at all, and that is totally normal. So you will get those nice juicy burps down the road when their stomach gets a little bit bigger and they're taking more in. But in the first couple days, you might not hear anything, but it's still really important to burp them. And then when you're done with that, I would highly recommend that you don't just put them right back in their crib. Imagine eating a really heavy meal and then lying down in your bed right after. Probably you're going to feel some things coming up. So you want to let them digest a little bit by holding them, and you can hold them in whatever position you want. But gravity can help things start to move down, and this is a great opportunity to just have a nice relaxed baby that you're enjoying, and you can rub their back, or you can just hold them, or have somebody hold them for you, and let them digest for maybe 15 minutes before putting them back to bed. All right, so let's talk about if you find them and they're spitting up. It might be during a feed, it might be in between feeds at any time, but babies do spit up and they have regurgitation, and that is totally normal, but I want to show you guys what to do. If they are having like projectile vomiting, or they're turning blue in the face or chest, that is not normal. So definitely want to react really quickly if you see that. And no matter what, you're going to just do exactly what I just showed you, which is to basically burp them in any position that you can get to very fast. So if they're in the crib like this and I see them spitting up, I just lean them forward like that and start patting their back. And if they were struggling, I might pat a little bit harder. And gravity is just gonna help whatever's in their mouth come out. And yeah, they're just gonna start crying, and it's like, yeah, that was a lot. Okay, so Let's say there's a lot of fluid in their mouth, and babies aren't very good at spitting, so you might want to help them out a little bit with that. And there is a tool called a bulb syringe that is a suction device, and it can help get fluid out of their mouth if they're just kind of gurgling it and they just can't get it out. So the way that you use this is you just compress it, and then you're going to insert in the mouth, and then as you pull out of the mouth, you slowly release it back, and it sucks out any fluid out. And then you can just, you're gonna have fluid in here now, so you can just kind of get rid of it onto a towel or something like that. Now, when you insert it in their mouth, you don't wanna go straight back, because that's gonna cause them to gag, obviously, if you go straight back to the throat. So you wanna aim for the back corners of the mouth and kind of the cheek, come out the cheek area a little bit, and just gently sucking the fluid out as you go. Now, you can use this in the nose if they have fluid in the nose, you hear it up in there, but I just want to caution you not to use it a lot in the nose, because it will cause inflammation of their nasal passages, which leads to a very snorty baby, and that is not fun for anybody. So only if you really see and hear fluid in there and you're just trying to help them out here and there. You may never need to use this at all. It's just a nice tool to have. If you have a hospital birth, make sure you take it home with you from the hospital. If you're doing a home birth, ask your midwives or whoever you're doing it with if they're going to supply one of these. They usually bring it, and if not, you can definitely buy one online. But it's just a nice tool to have, and later it can be like a fun bath toy or something like that. To clean it, you can just kind of use soapy water and just you can suck it in and squeeze it out and just wash it with soapy water, so you can keep it for a little while. All right, so that's it for burping and spit up.